Thank you all. What'd you say those three things were? Think big.
Start small.
We don't do any of them in Washington. So you do that here. Governor, honored to be with you. A little bit about Henry. I've known Henry for well over 20 years now, but you're the easiest guy in the world to work with. You're always on the phone when you need to be on the phone and asking good questions, and I think we got a great partnership, and I really appreciate your leadership. Mr. President, thank you for having me here today. Greenville is the most transformational place in South Carolina. Knox, you should be very proud. Amen. I came over here in the 70s to go to the wrestling matches. Still do, actually. Me and Trump like that a lot, actually. But you'd have to run to your car. Greenville has changed as much as any place in the country for the better, and that's due to your leadership and the people on council. The university here, you could not have planned this I don't know how long it's taken to modify this building, but did you ever think you would be opening it in the middle of a pandemic? Just think. Whatever appreciation we had for doctors and nurses and healthcare professionals before has gone up 1,000 times. And my goal is to make sure that when your graduates go out into the healthcare arena, they don't have to depend on China for their equipment. Now, this has been a wake-up call, folks. Our country wasn't prepared. We'd outsourced all the PPE that your graduates need to take care of the rest of us. We're going to make a decision, hopefully here in the next couple of weeks, to start bringing that back. Most of our drugs are made in China now, and we need to bring back the medical supply chain. But, I just turned 65. I'm a baby boomer, so get as many graduates out as soon as you can. To those men and women who go through this facility and who graduate, you will be doing yourself, your state, and your country a great service. I can't think of a better thing to do to help mankind than to go into healthcare professions, and I would just end on this note. This all started in China. Somebody in China was the first patient. The first positive was in January in the United States. 5 million positives later, here's where we find ourselves. This idea about global health. I cannot tell you how important it is to understand that when it comes to pandemics, we're all in this together. And I want to do what I can to make sure that the poor people who are struggling in Africa, if we ever get a vaccine, to make sure we share it with them, because if we don't, it will come back here. The thing I like most about this university is that you know who you are and what you believe, and that's important in difficult and troubling times. Thank you for having me.
Thank you.